Dear students, we will discuss a clinical case today, very commonly seen in the surgical ward OP and commonly discussed with the undergraduates and postgraduates and commonly managed by any surgeon, general surgeon or specialty surgeons, plastic surgeon, like that. So you can see that in the leg, in the foot, leg and foot, extensive slough is there. Slough is dead soft tissue in situ. You should remember the definitions of slough, necrosis, sequestrum, gangrene, wet gangrene, dry gangrene, line of demarcation. All the things will be asked. So you can go through my clinical book, ulcer chapter. All these definitions are there. You can always learn that. And this is that there is no signs of healing at all. Activities, discharge is there. So it is nothing but spreading ulcer, probably in diabetic patient. You can see that extensive it is. Entire foot is involved with the extended to the leg. There is something here also. So what are the different types of ulcers? You know that ulcer is a break in the continuity of epithelium due to cell death or molecular death. That is the definition, all of you know. The wound is different. Wound is a very gross terminology. It is a disruption of tissue structurally and or functionally. So word is, all words are important. Destruction of tissue structurally or functionally. That is a wound definition. Whereas ulcer is a type of wound actually. So every wound is not ulcer. Every ulcer is a type of wound actually. So ulcer is a type of wound. Wounds are very long, maybe organ injury, bone injury. Everything is called as wound actually. So definition of wound is different. This is different. So wound is disruption of the tissue. Disruption actually, not destruction. Disruption of the tissue. That is the important thing. Structurally and or functional. Disruption. So whereas ulcer is break in the continuity of epithelium, lining, due to molecular death or cell death. So word meanings are different. Just remember these things. So clinical classification of ulcer is commonly asked in the Viva. Ulcer is a short case kept. Oxy it will be kept. And different types of ulcers are short note. So many MCQs will be asked in the ulcer. How to manage ulcer is a Viva question. Oxy they will ask. Theory also they will ask. So you should know everything about ulcer. It's a very common basic thing in surgical site. Remember. So spreading, healing, non-healing, callus. This classification with the photographs are there in my clinical book with the explanations. You can go through my clinical methods in surgery and also my manual of surgery ulcer topic both. It is there in detail with the photos and illustrations with the different edges. Ulcer again can be acute or chronic, and pathological or etiological classification is there. Specific, malignant, non-specific, others, mortals, potential surveillance, diabetic. So many things are there. Many times these are the things asked as a Oxy question, MCQ question, Viva question. Should remember what are the causes for different types of ulcer. So this etiological or pathological classification also important. Remember, this is the clinical classification. This is the depending on the duration, acute and chronic. So these are the three basic classifications. Other than vaginal gradings is there. So that also you have to remember. So investigations are discharge study, culture sensitivity, if required cytology, if required AFB, like that. And wedge biopsy from the edge, minimum 2 biopsy you have to take, ideally diagonally from opposite side. And X-ray of the part or imaging, maybe MRI if required. And arterial and venous Doppler is important to find out the circulation. Sometimes you have to do angiogram and lymph node examination, proper examination of the ulcer, margin on inspection, edge on inspection and palpation, base on palpation, floor on inspection and palpation, surrounding area, different types of edges, punched out, undermined, everted edge, beaded appearance. All those things are the causes should be known. For that, you should read my clinical methods of surgery and manual of surgery, SRB's manual of surgery. And management also important, assessment of ulcer also important, vaginous grading also important, VAC therapy they will ask, ESOL, full name is Edinburgh University solution of lime, contain boric acid, mainly calcium hydroxide and bleaching powder. So that where you can, it's colorless solution. but in a blue bottle, so that we can give a Usol bath, you can clean with the Usol, it is a de-sloughing agent. So all these things are should know. So read my ulcer topic in manual and clinical methods, how to examine ulcer, it's very, very important. So in the lymph nodes or drainage lymph nodes should be checked actually. Also systemic exam is also important, mainly cardiac patient, diabetic patient or asthmatic patient, and other causes. Spine should be examined, maybe spinal disease may cause ulcer. So examining systemic part also very, very essential when you examine a ulcer. Varicose vein you have to examine standing. Peripheral pulse should be examined. Dorsal pedis, posterior tibial, at least popliteal, femoral, or both limbs should be examined. And gait should be checked. Examination standing also important. So all these things are very important when you look into the ulcer as a whole. It's a very, very common surgical entity which you have to remember. So treatment, I said, skin grafting. So remember about all these things, vaginal cladding, causes, use of vac therapy, everything short note, Viva they will ask, Oxy they will ask, MCQ they will ask, remember. So you can always go through my clinical methods in surgery and manual of surgery for this. So this is spreading ulcer. I have an idea about everything about ulcer. That's the point I want to test actually. And for that you can go through my manual of surgery and a clinical method in surgery which gives detail about these things. Students, please subscribe my YouTube channel. And share with your friends and colleagues and press the bell to update your surgical knowledge about day-to-day basis for 5 to 10 minutes, like instruments, specimens, x-rays, images, operative procedure, clinical tests, clinical case scenarios, all those things. So daily you will learn surgery for briefly without much stress. And also once in 2 weeks you will have a live session where in detailed discussion for more than 1.5 hours with discussion with the clinical presentation by a student. So you can have an interaction with that, and also we join live session, you get a certificate. It will be very useful for your future career. So students, again I request to please subscribe my YouTube channel, share with your friends and colleagues. So answer the MCQ. The perniosis is A, B, C, D. Put the right answer in the comment box. I appreciate your answer. And Buruli ulcer is, what is the right answer? A, B, C, D. Put the right answer. Again, I appreciate your answer. So quotation of the day is protect what is precious, preserve what is necessary. So both are very important. Preservation, protection. Both are equally important, equally attached to each other. So that is what again important. In surgery also, you protect the organ, you preserve the organ. That's why these two words are very important for surgical career or for surgeons as such, in their surgical profession as such. Students, and also go through my SRB's Manual of Surgery current edition for in detail subject matter with the MCQs online, and everything in Oxy is covered from general surgery, endocrine, thyroid, breast, parathyroids, GI surgery, everything, liver, gallbladder, GI tract, stomach, hernia, urology, specialties, cardiothoracic, neurosurgery, basics, instruments, specimens, anesthesia, and briefly recent advances with a lot of illustrations, photos, quotations, and treatment strategy, management policy, principles with a lucid, understandable language. With the wherever Oxy topics are there, also it is covered for both UGs and PGs. So make use of my SRB's Manual of Surgery for your better understanding of surgery knowledge as such, and also my SRB's clinical methods in surgery. It covers all clinical examinations, general surgery to hernia, thyroid, breast, varicose vein, vascular diseases, GI examination, abdomen, briefly orthopedic, and with the instruments, specimens, and briefly images as such. Video examination of each topic, each chapter, which will be very, very useful for your clinical examination, and principles of examination with a lot of photos, and brief differential diagnosis in tabular form. But it doesn't contain, because it is a clinical book, it doesn't contain any management policy. For management policy, you have to go through the SRB's Manual of Surgery. But clinical book, it is very, very useful. Everything in detail it is there. So please purchase my clinical book and Manual of Surgery to have a complete understanding of the surgery as such. And my operative surgery current edition with the 2-volume extensive book, about 10,000 photos and illustrations, very, very useful for upcoming surgeons, surgical surgery PGs, and practicing surgeons, in detail, step by step, all procedures, even GI surgery, general surgeries, endocrine surgeries, everything step by step with a lot of photos and illustrations, with the instruments, energy sources, everything it is covered. It will be very useful for all surgeons who is practicing. Before surgery, they can go through the steps and do the procedure skillfully without much problem. So please go through my SRB's operative surgery atlas and guide atlas, actually text and atlas, current edition, 2-volume book, very very useful. Definitely you'll understand the technique, small procedure to big major procedures as such. My SRB's tissue approximation, again brief small atlas book, 100 pages, which shows how to approach sutures, different suturing technique, different methods, different types of suturing, different skills of suturing, different suture materials, and skin suturing, deeper tissue suturing, bowel suturing, laparoscope suturing, with the principles and also with the video of suturing. How to do all suturings or videos are there. That will be very very useful for all students. So please go through that, my SRB's tissue approximation book also. So students, again I request to subscribe my YouTube channel to have a best surgical update as such, a daily day-to-day basis for your clinical knowledge, image-wise, and also join live sessions once in 2 weeks for extensive knowledge about the clinical discussions for more than 1.5 hours. So again request, please subscribe my YouTube channel, share with your friends and colleagues, and press the bell. So students, I hope you understood this lecture very well. Thank you so much.